Today we will be doing a blood pressure assessment. But before we do an assessment, we must do a pre-assessment, where we must check to see if our patient is wearing the proper cuff size, that their back is supported, feet on the floor uncrossed, arm elevated at heart rate, and it's taken over the bare arm. As I mentioned, we must check to see if our patient's back supported, wearing the proper cuff size, feet on the floor uncrossed, arm elevated, and it's taken over bare arm. Now let's do the blood pressure assessment. When measuring blood pressure, the first thing you want to do is locate the brachial artery. Place the arrow marked on the blood pressure cuff over the brachial artery. Wrap the cuff around the patient's upper arm so that the bottom of the cuff is at least 1 inch above the elbow. The cuff must be even and snug. Next, place the stethoscope earpieces in your ear, but make sure that the ear prongs are facing forward. Then place the bell of the stethoscope over the brachial artery. So when wrapping the cuff around the arm, make sure the cuff is fully deflated. Remember to place the bell of the stethoscope on the brachial artery. Then turn the valve of the bulb of the cuff clockwise to prevent any air from escaping the cuff when inflating. Now we'll begin inflating the cuff to 180 millimeters of mercury. The first sound you hear will be the systolic pressure. Once you note the systolic pressure, turn the valve counterclockwise to release the air from the cuff. When releasing the air, release it at a rate of 2 to 3 millimeters of mercury per second. Note that when the sound disappears, this is the patient's diastolic pressure. After you record the diastolic pressure, fully deflate the cuff.